This is actually the third day of my official tour of federal tertiary teaching hospitals in Lagos. As you've all followed me in the last few days, this is almost the last stop, but I'll still be visiting the neuropsychiatry hospital, the annex in Oshodi, to conclude my first official tour for the country, starting from Lagos. We will be visiting several other states in the next several weeks to months. Now, to answer your question directly about what to expect, before we go to what to expect, let's look at what's on the ground. As I've said multiple times, that federal hospitals, federal tertiary hospitals they've been the hospital that have really saved and rescued our healthcare system in this country. Several of these hospitals they have facilities that you can compare to anywhere in the Western world, and the kind of services they're providing is exceptional care to a patient at a really discounted care. Federal government is funding these hospitals very well, though a lot of the hospitals will still ask for more, but they are adequately funded now. But as part of the leadership in the Ministry of Health now, myself and Honorable Mr. Pate, we're committed to significantly to continue to fund this teaching hospital. And beyond funding a teaching hospital, a federal tertiary hospital, we will also be working with the sub-national government, the various state governments, to help them improve capacity and improve the care they continue to deliver to our citizens. Now, what to expect? You've seen me go around. This particular hospital is dear to me. I was the chairman of the board, the last board that was dissolved. We did a lot of things, and with the help of the medical director, the members of the TMC, and other staff of the hospital, hospital is a model. It's it set a lot of pace. This a pace setter, and we will reciprocate what we're seeing here in several of our teaching hospitals. So I'm very happy with what we've seen, and what to expect. More specifically, to address your question, is comprehensive, very good healthcare delivery to our citizens. That's what the president has mandated us to do. President Bola Ahmed Tinubu takes healthcare delivery to the citizens of the Nigeria. He takes it very serious, and he wants us to work in providing a setup, developing, rebuilding, revitalizing an healthcare delivery system in Nigeria to provide that comprehensive care to each citizen of this country. We've laid out 4 big priority areas that we will be working in the Federal Ministry of Health to deliver to the people of Nigeria, and these priorities align with the 8th priority area of President Bola Ahmed Tinubu. We will improve healthcare governance by strengthening the healthcare system, making everybody more accountable. We will improve our population health outcomes by really strengthening our healthcare delivery system. And the third one, we would unlock the value chain of our healthcare sector so that we can begin to create jobs, durable, good-paying jobs for the young citizens of this country. And then we're beginning to look at health beyond physical security, health as social security and national security. So several of the priority areas of the MD fit well into this 4 priority area, and that's what we're aggressively, meticulously, continuously working on, and we're already working, and we're beginning to see some of the effects. Okay, it's a significant issue around the world. Human resource for health, it's an issue globally. Today, if you look at some of the data, there's almost 18 million human resource for health deficit all across the world. Nigeria is not an exception. The unfortunate situation we have in Nigeria is people are going to Western world and to other parts of to other countries to seek employment. But we're beginning to improve our infrastructures, so also now people will start coming back. And beyond that, before people start coming back, we also have to increase production, and you've heard me and several of my interviews, press releases on how we're going to increase the production in our healthcare sector. We're going to double. We've put plans in place to double the enrollment in our medical school in the next academic year. I've met with the registrar of the Nursing and Midwifery Council on how to also double the number of nurses we're training and graduating every year. We're doing it with other specialties as well, the medical laboratory scientists and other things. We are working very hard to increase and double our production of human resource for health. That's the way we can quickly plug the hole, the leakage we have now. But as we continue to do that and improve our healthcare delivery system, people will start coming back to the country, and this problem will be a problem of the past in the next few years.
So your reaction to the minister's visit, sir? What do you have to say?
Happy. Fantastic. If you have somebody who is close, was your former board chairman, that knows your challenges, that is up there, has now come down to your place to listen to you, you'll be happy. And because we have trust that many of those things that we have asked him, he will deliver. Look at all the parameters. We are 78 years old. We are understaffed. We are working under some manageable conditions. And we are delivering services. So how would you rate yourself? We rate ourselves very high. We are proud of the work we are doing. We feel that we have immense room for improvement. But we are proud of ourselves. Like the Honorable Minister said, manpower is a challenge globally. And I presented to him our own challenge. And his suggestion, when he was our board chairman, and that's what he's pushing out now, that's a global suggestion on how you can solve the problem. And I agree. In fact, I agree with the Honorable Minister 700%, 1,000%, that if you have a shortage of manpower, and you are crying that people are leaving, in as much as those people are leaving because they want to leave, then you produce more and more. You have 230 million Nigerians, 40 to 60% are youth. Produce more manpower. Simple. After a while, you saturate those places and you have enough to use. And also, there will be generating remittances for you. So that's a solution.